Hi, I'm Garvin. This telecast is on Neurontin, or gabapentin, the chemical ingredient. So gabapentin belongs to a group of medicines used to treat epilepsy and peripheral neuropathic pain, which is long-lasting pain caused by damage to the nerves. It is available as a 100mg, 300mg and 400mg capsule. For adults and adolescents with epilepsy, take a number of capsules as instructed. Your doctor will usually build up your dose gradually. The recommended starting dose will generally be between 300mg and 900mg each day. Thereafter, the dose may be increased as instructed by your doctor up to a maximum of 3,600mg each day. And your doctor will tell you to take this in 3 separate doses. So once in the morning, once in the afternoon and once in the evening. For children aged 6 years and above with epilepsy, the dose will be decided by a doctor as it is calculated against the child's weight. The treatment is started with a low initial dose, which is gradually increased over a period of approximately 3 days. The usual recommended dose to control epilepsy is 25 to 35 milligrams per kilogram of body weight each per day. It is usually given in 3 divided doses by taking the capsules each day, usually once in the morning, once in the afternoon and once in the evening. Gabapentin is not recommended for use in children below 6 years of age. For adults, take the number of capsules as instructed by a doctor. Your doctor will usually build up your dose gradually. The recommended starting dose will generally be between 300 to 900mg each day. Thereafter, the dose may be increased as instructed by a doctor up to the 3,600mg each day. And your doctor will tell you to take, again, in separate 3 doses, morning, afternoon and evening. Your doctor may prescribe a different dosing schedule or dose if you have problems with your kidneys or are undergoing hemodialysis. If you're over 65 years of age, you should take the normal recommended dose of gabapentin as said above, unless you have problems with your kidneys, as your doctor may prescribe a different schedule for this. If you have the impression that the effect of gabapentin is too strong or too weak, talk to your doctor or pharmacist as soon as possible. Common side effects of this drug include dizziness, feeling drowsy, tiredness, anxiety, weight gain, nausea or constipation. Talk to your doctor or pharmacist before taking gabapentin if you suffer from kidney problems, on hemodialysis, or if you develop signs such as a persistent stomach pain, feeling sick and being sick. Contact your doctor immediately, as these may be symptoms of an inflamed pancreas. Tell your doctor or pharmacist if you are taking, have recently taken, or might take any other medicines, including medicines obtained without a prescription. If you're taking any medicines containing opioids such as morphine, please tell your doctor or pharmacist, as opioids may increase the effect of gabapentin. If gabapentin and antacids containing aluminium and magnesium are taken at the same time, absorption of gabapentin from the stomach may be reduced. It is therefore recommended that gabapentin is taken at the earliest 2 hours after taking an antacid. Gabapentin is not expected to interact with other anti-epileptic medicines such as phenobarbital, phenytoin, sodium valproate or carbamazepine, or the oral contraceptive pill containing norethindrone, with or without ethyl estradiol. Gabapentin may interfere with some laboratory tests. If you require a urine test, tell your doctor or hospital that you are taking gabapentin. It can be taken with or without food. Gabapentin should not be taken during pregnancy unless you were told otherwise by a doctor. Effective contraception must be used by women of childbearing potential. Contact your doctor immediately if you become pregnant, think you might be pregnant, or are planning to become pregnant while taking gabapentin. Do not suddenly discontinue taking this medicine, as this may lead to a breakthrough seizure, which could have serious consequences for you and your baby. Gabapentin is passed on through human milk. Because the effect on the nursing infant is unknown, it is not recommended to breastfeed while using gabapentin. Gabapentin may cause dizziness, drowsiness and tiredness. You should not drive, operate machinery or take part in other potentially hazardous activities until you know whether this medication affects your ability to perform these activities. If you take more of this drug than you should, call your doctor immediately. If you forget to take a dose, take it as soon as you remember, unless it is time for your next dose. Do not take a double dose to make up for an earlier forgotten dose. So if you have any questions, you can contact me through the Life Pharmacist. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.